Heart palpitations and headaches together. Causes and treatment. Heart palpitations and headaches can occur together due to factors such as low blood pressure, dehydration, and diet. Some conditions may require treatment, but in some cases the symptoms can pass on their own. Heart palpitations are heartbeats that are more noticeable. For example, they can cause a pounding or fluttering feeling. Headaches cause pain in the head, face, or neck. Heart palpitations and headaches can occur together. This video will discuss several possible causes of this and how to treat them. Medications. Some medications, including vasodilators and the calcium channel blocker, nifedipine, can cause both headaches and heart palpitations as side effects. Anyone who experiences these side effects from taking medications can talk with their doctor about trying other approaches. Dehydration. Dehydration occurs when the body does not contain enough fluids or water, which it needs to function well. Water is essential for bodily cells to function correctly. The body loses water through breathing, sweating, and urinating. When levels drop too low, however, it causes feelings of thirst. Dehydration can cause a person to experience both heart palpitations and headaches. Staying dehydrated can also cause other symptoms, including a decrease in the volume of urine, dark urine, a dry mouth, tiredness, dizziness, weakness, an increased heart rate, dry skin, no sweating, fever, loss of consciousness. Treatment. Treatment for dehydration involves replacing fluids as well as identifying the cause of the fluid loss. Consuming water will treat most cases of dehydration. In most serious cases, however, intravenous fluids may be necessary. Caffeine and alcohol. Consuming caffeine or alcohol can cause headaches and heart palpitations. Some people will experience these effects with lower doses than others, depending on their genetics and tolerance. Caffeine. One 2015 article notes that caffeine, especially at high doses, can lead to heart palpitations. However, caffeine can actually help relieve headaches instead of causing them. Indeed, the American Migraine Foundation stated that with occasional use, caffeine can help provide headache relief. If a person uses caffeine daily, however, they may develop a tolerance to it. This can cause a person to become dependent and potentially lead to caffeine withdrawal. Symptoms of withdrawal can include fatigue, difficulty concentrating, headaches, nausea, depressed mood, tremors. Caffeine withdrawal can also lead to anxiety, which in turn can cause headaches and heart palpitations. Alcohol. According to the National Heart, Lung and Blood Institute, alcohol can cause heart palpitations. It can also cause headaches, especially when a person has a hangover. Like caffeine withdrawal, alcohol hangovers can lead to feelings of anxiety, which can result in heart palpitations and headaches. Treatment. Moderating caffeine and alcohol intake can help moderate these effects. If a person has a hangover, they can help ease the symptoms by drinking water, eating nutritious foods such as fruit, eating bland foods, resting, taking over-the-counter medications. If a person finds that they are becoming dependent on alcohol, they should try to seek help. Anxiety and panic attacks. Anxiety disorder is a common mental health condition that can cause fear, anxiety, and worry, alongside other symptoms. Anxiety can also cause physical symptoms. According to Mind, a charity based in the United Kingdom, physical symptoms of anxiety may include heart palpitations, headaches, pins and needles, a churning sensation in the stomach, fast breathing, sweating and hot flashes, nausea, backaches and other aches and pains, lightheadedness, changes in sex drive. Anxiety can also lead to panic attacks. During a panic attack, physical symptoms can appear suddenly, including a pounding heartbeat, dizziness, feeling faint or lightheadedness, feeling either very hot or cold, nausea, chest pain, difficulty breathing, abdominal pain. Treatment. The symptoms of anxiety and panic can be frightening, but it is important to remember that the physical symptoms will pass. In the meantime, during a panic attack, a person can try focusing on their breathing, stamping on the spot to help control their breathing, focusing on the senses such as touching something soft, or focusing on the flavor of a piece of gum or candy. Using grounding techniques such as focusing on the sounds around them, breathing slowly, or wrapping themselves in a blanket. Treatments for anxiety and panic disorders can include a combination of medications and psychotherapy. Anemia. Tissues around the body require oxygen to function correctly. Anemia is a blood disorder wherein the body lacks functioning red blood cells to carry oxygen around the body. Alongside headaches and rapid or irregular heartbeats, anemia can cause tiredness, weakness, shortness of breath, cold hands or feet, chest pain, yellowing of the skin. Treatment. People with anemia may lack iron due to blood loss or an unhealthful diet. In these cases, increasing iron in the diet will usually be enough to treat anemia. Chronic disease and other causes of anemia may require different treatments. However, for example, doctors may treat the underlying condition with medications or blood transfusions. Low blood pressure. Blood pressure refers to the force of the blood pushing against the walls of the arteries. When a blood pressure reading is below 90 by 60 millimeters of mercury, a person has low blood pressure or hypotension. Although many people do not have symptoms of low blood pressure, a person may experience headache and heart palpitations alongside lightheadedness, confusion, blurry vision, weakness, tiredness, back pain, nausea. Treatment. Treatment will typically include making changes to a person's diet and medications, as well as potentially wearing compression stockings to help improve blood circulation and increase blood pressure. Causes after eating. Headaches and heart palpitations that occur after eating could be a result of drinking caffeine or alcohol with the meal. Some people are vulnerable to headaches or migraine episodes after eating. For example, people with low blood sugar levels can experience reactive hypoglycemia. This occurs when a sudden spike in blood sugar levels after eating causes symptoms such as headaches. Food allergies can also cause headaches or migraine episodes. Causes alongside fatigue. Headaches and heart palpitations alongside fatigue could be symptoms of anemia. In other cases, this may be due to intense bouts of exercise. In rare cases, exercise can cause a migraine headache. The headache may occur alongside heart palpitations and tiredness from the exercise. When to see a doctor. Some common causes of headaches and heart palpitations, such as dehydration or diet, may not require medical treatment, making certain lifestyle adjustments should help prevent these symptoms in the future. People who regularly experience these symptoms may wish to see a doctor. They could be symptoms of an underlying health condition, such as anemia. Not all conditions will require treatment, however. A person should contact a doctor immediately if other severe symptoms such as chest pain occur.